Once again, they were going to recruit new personnel. The guy from the social services told me that this time it was going to be good. They would find someone who didn't just quit or who treated me bad. He told me it would be people that would be by my side every day, eat with me, talk to me. And then I asked, but if these are people who are going to be working with me, why am I not part of recruiting? Why am I not included in the process? They thought about it, and then I was. I also got to decide about the most important competences of the personnel that was going to work with me. Not only the boss from the social services. And now, I feel it's much better. This is a quote from a user with intellectual disabilities in a small municipality in Sweden. A place where the municipality realized that even in basic things like recruitment for new personnel to the community housing, the user involvement can make the whole difference. People who use services are experts on how these services should be developed and delivered. They have the first-hand experience, they know what they need, what works well, and what does not. Increasing user involvement is a priority goal in all the Nordic countries. Research on user involvement and new methods has increased as a result. But do we really know what works? Do we know what is required for real user involvement? And how do we make sure that this not just becomes empty promises? How do we make sure that it leads to real change? Today, we will speak with both leading experts and researchers in the field. And we will also learn more about an upcoming compilation of knowledge on Nordic research on user involvement that will be presented. Welcome to the Nordic Welfare Centre's webinar on user involvement in the Nordic region. My name is Hanna Gerdes. I'm a Swedish human rights lawyer, and today I've been given the task to moderate this important webinar. Before we start, I would like you all to have some practical information. This webinar will end at 4 o'clock, and we will have 2 short breaks. We will also if you have any kind of technical questions, you will be able to ask them, as well as other questions. And I would like to give you some more practical information on that. Participants, just in a brief second. If you want to comment on something, I would like you to please use Slido for questions and comments. And in Slido, you can also ask technical questions. During the seminar, participants will not be able to activate video or microphone, and the webinar is in English, but it's captioned live in Swedish. So you can follow it in Swedish and in English. And with me today, I also have Marie, who is a communication advisor at the Nordic Welfare Centre. And Marie, she will be keeping track of all questions and all comments in the chat. And in the end of each session, we will also be able to get back to your questions in the panel. So let's see if Marie is there. There she is. Hi, Marie.
Hello, Hanna. Hi.
I just wanted everybody to see you. So we'll get back to you in a little while. I just wanted to introduce you and to be able to follow your voice. Thank you. I would like to actually try out Slido first of all. So let's see if we can have Slido. There we have it. So you can ask questions by using Slido, and you can do 2 things. Either if you have a mobile phone, you can actually take it out now and you can open the camera, and then you could put the camera towards this QR code that is in the picture now. And by doing that, you will enter automatically Slido. Or you can go into the browser and you can write www.slido.com. And then you enter the code 3980521. So 3980521. And Slido we will be using both so you can pose questions and you can pose comments, but we would actually like to start off by asking you a question by using Slido. So if you enter now, you will see a question. And the first question is what country are you from? So what is your country? So I'm going to be waiting here for a little while to see which answers that come in. And give you all a chance to have time to go into Slido. So you go into www.slido.com or you just use the QR code. And I see quite different answers coming in now. There seems to be quite a lot of participants joining us today from Sweden. We have some participants from Norway, some participants from Finland, some participants from Denmark, and some others perhaps as well. So I hope you all had time to enter. You have to go into www.slido.com. Perhaps if it's possible, we could get the QR code again. Is it possible to put it on? So yeah, here we have it. So once again, if you haven't entered yet, please ask questions by using slido.com. You can take your camera from the phone and you have the QR code, or you can just go into the browser and you use the code 3980521, 3980521. So we see we have quite a lot of users from Sweden joining us today, a lot of participants, and a lot of people also from Finland and Norway. And nobody seems to be joining us today yet from Iceland, but we will have some more people joining us soon. We do have some guests today joining us from Iceland. So now I see more and more people are answering this question. It's good. We have to give it a little time so everybody has a chance to get into the Slido. And I really advise you to do this now because we will be using this through the whole sessions for you to be able to pose questions. So it's good to have a chance to try it out. So let's perhaps move on then to the next question. And the next question that we would like to know is, what sector do you come from? So what is your background? Which sector do you represent today, or do you work in, or do you feel at home in? Is it the public sector? Are you from a user organization? Are you from a university or from other? And other, of course, you define yourself. So we are very interested about your background. We seem to have almost 50%, 44. Now it's changing because we are getting a lot of answers. So we're waiting for a little while for more answers to get in. Let's see. Yeah, so now more and more people are managing, at least here, to see, getting into Slido, I see, because we are getting more and more answers. Thank you so much. And most of you seem to be coming from the public sector, even though there's quite a lot of people also from university and from user organizations. And let's move on to the last question. And the last question from us to you is, what do you think is the most important motive for increased user involvement? So what would be the most important motive for increased user involvement? I like the example that I told you about just in the beginning. So what would be the most important motive for that? Is it to increase democracy? Is it to give increased power to the individual? Is it because it's important to improve social services? Or I think there is actually another motive that you didn't list here. So then you can just pose other as an answer. So what would you say? What is the most important motive? And if you just logged in a little bit late now, then you can just log into slido.com. You do that by entering that in the browser, or by taking your phone and opening the camera towards the QR code, and then you enter Slido automatically. And the code is 3980521. And here we can see that most of you believe that the most important motive for increased user involvement is actually to give increased power to the individual. So that's the most important reason. And then quite a lot of you also think it's important to improve social services and also to increase democracy. So thank you so much for giving your takes on this. We're very happy to have that. We're going to have a lot of researchers and guests today joining us and speaking about different aspects of user involvement. And we're going to get back also to the responses that you gave. Now I would like to pose a couple of questions to Lars. Lars Lindberg is a senior advisor at the Nordic Welfare Centre, and he has a long experience working with disability policy in Sweden. Amongst many things, Lars has worked with the Ministry of Social Affairs with responsibility for coordinating disability possibilities. And he's also been the head of the Accessibility Centre at the Disability Ombudsman. And today he works at the Nordic Welfare Centre that is arranging this webinar today. So I want to say hi to you, Lars.
Thank you, Hanna.
Welcome. Very happy to have you here. Lars, what is the key reason that the Nordic Welfare Centre is arranging this webinar today?
First, I would like to say a few words about the Nordic Welfare Centre. We are an institution under the Nordic Council of Ministers, social and health sectors. And our mission is to contribute to the development of welfare initiatives in the Nordic region. Back in 2018, there was a review of the social sector in the Nordic region that was presented on how the Nordic region could be strengthened. One conclusion in the report was that there was a need for increased focus on considering the user perspective in development of social welfare services. And one outcome of this report was that the Nordic Welfare Centre was commissioned to carry out a project on user involvement. And this webinar today is a part of the project. Another important part was to make a compilation of research of experiences of user involvement. And this report will be published later this autumn, and everyone will be able to get it when it is published.
And we're going to be hearing more about this compilation today because that's one of our guests who will be presenting that. So I have another question for you. What are your expectations on this webinar today? What do you hope for?
Of course, to listen to many exciting presentations and discussions. And of course, that the webinar itself can contribute to how user involvement can be strengthened and increased in the Nordic region. And of course, to get many interesting comments from you who are listening today.
Thank you, Lars. So I think it's actually time now to present our first speaker of the day. Urban Markström is a professor at the Department of Social Work at Umeå University. He is also affiliated to the Helsinki University as a guest professor and to the Center for Evidence-Based Psychosocial Interventions. Urban's research concerns different aspects of psychiatric disabilities. And I would like to remind you that during this presentation, you can ask questions all the time and pose comments to Urban. And you will be doing this by Slido that we've already been using today. So if you want to pose a question to Urban or if you want to pose a comment of any kind, please just log into www.slido.com. The code is 3980 521. And then you will be able to make comments, pose questions, and we will try to get as many of these comments and questions as possible into the webinar, and we will be doing this in the panel in the end. So we will definitely get back to everything that you write. So with this, I would like to say warmly welcome, and I hand over to you, Urban. Nice to meet you.
Thank you, Hanna. Nice to be here, and thank you for being invited to this seminar. I will give you an extremely brief introduction to the theme for this seminar, user involvement. So just to start, I would like you to thank you. You can take the next slide, please. I would like to start with just asking a question about are service users' knowledge and experiences taken into account? That's a quite natural point of departure, I think. Next slide, please. When it comes to my own field of research, mental health services or community mental health services, the answer I think would be no, at least from a kind of historical point of view. My field has been characterized by a lack of involvement, actually. So mental illness has been defined by others than people with own experience, and the service users has been, as you all know, separated from the society and the public for a long time during the mental hospital era. And there has been a lot of paternalism and oppression at this particular field. Next slide, please. But I think we are gathered here today because of a reason, and I think it's all about the reconsiderations of positions that has been going on this particular field. So nowadays, many people are emphasizing the importance of giving a voice to the citizens, or that service users should participate in decision-making processes, for example. Next slide, please. And today there are a number of buzzwords flying around. For example, terms like public and patient involvement, person-centered care or support, or not at least the term co-production. That is going to get more and more popular, I think. In addition, you can also identify a number of supporting policies for service user involvement, both internationally and not at least in the Nordic countries. For example, we have the CRPD, of course, but also just one example from Sweden is the Swedish Patient Act. Next, please. Thank you. Okay, so the question is, of course, why are we doing this? What are the arguments for service user involvement? And here's just 3 attempts to summarize some of the core arguments behind service user involvement. In my point of view, I think it mostly about on one hand, arguments about strengthen the democracy or developing the democracy, and in that sense, service user involvement could be seen as a sort of goal in itself. I think the other core argument is about developing services through involving people with lived experience and their own histories and experiences, and therefore we could increase the quality of services. So we have democracy argument and we have effectiveness argument, I would say. Next slide, please. User involvement activities can also, of course, be identified on different levels and with different qualities. So just to simplify it a bit, you can say that we can find service user involvement at an individual level, at service level, at a kind of organizational or system level. Next slide, please. When it comes to measuring the quality of service user involvement, this could be, I think, a quite okay illustration about that. This is based on, but this is the quite famous ladder of participation developed by Arnstein in the late 60s. And as you can see, we have the bottom ladder called manipulation, and we have the highest level of participation during this model called citizen control. So this is just one illustration of how people try to measure the quality of service user involvement. Next slide, please. Okay, but despite all this enthusiasm over steps taken towards more service user involvement, I think there's still, of course, a number of barriers, and quite well-described obstacles are, for example, lack of information to the service users in this kind of processes, financial and time costs, both for service providers and the research community, for example, and also more general concerns over representativeness. Then there's also more complex and hard to grasp phenomena connected to service user involvement called, for example, tokenism, or what is often called cooption. Next slide, please. I would just like to as a last step in this presentation, give some examples of positive practices in mental health services. We have quite a lot of examples about people with own lived experience being involved in prioritizing and conducting research. We are trying to do that in one of my research programs called User Involve. We have a lot of examples about people being involved in staff selection. We have also a number of examples when people with lived experiences are employed as as mental health workers called peer support workers. And finally, we also have a number of examples of people being involved in education and training. Next slide, please. This is just my final slide. I would just show up some examples, some current examples from the field of mental health in Sweden. I think we will talk about some of these examples later on this afternoon. And there's examples of so-called shared decision making and coordinated care plans. We have initiatives about patient-controlled admissions in inpatient care in Sweden. We have a lot of organizations hiring peer support workers. We have attitude ambassadors working with anti-stigma initiatives around the country. We have also a number of examples of so-called user-focused monitoring, which is a kind of evaluation strategy, including the perspectives from the service users. And we also have a number of different kind of so-called user councils in both Swedish municipalities and in the healthcare sector. Okay, next slide. That was all from me. Thank you.
Thank you, Urban. But please stay. I have some questions for you. I think we have a lot of questions for you also coming up later from all the people listening. But I wanted to ask you, because I know you've been doing research for a long time with an emphasis on mental health and disability. And you started by looking at the Swedish psychiatry reform. And this is also an area where there has been quite a lot of investigations during many times, and many initiatives have been taken. But I mean, you've been working for quite some time. So what is the biggest difference that you see in how researchers view user influence today and when you started? Like, what has been the biggest development?
Well, that's a quite tricky question, because I think it could be hard for a person to look back, like 20 years ago and try to evaluate how we analyzed these kind of questions then compared to today. But I think during our analysis of the psychiatric reform, for example, I think we were quite occupied of the sort of substantial changes that were happening during that day. Psychiatry was like literally unlocking the doors to the mental hospital. So I think the analysis was sometimes a bit, you can say rough and shallow compared to today. I think today, 3 decades later, we have a broader sort of repertoire of concrete involvement practices, of course, but also we have an availability to theoretical concepts. I think we have richer and more comprehensive frameworks we can work with when we are analyzing service user involvement. So I think we can, to summarize, make more advanced analysis today compared to, 20 years ago.
Yeah, and there you can also see how research and actually law goes together. I mean, me being a human rights lawyer, I do believe I've seen quite a lot of difference since we have CRPD, because CRPD emphasizes the active involvement of people with persons with disabilities, and the rights have been strengthened. But have you said, if I look at this from a rights perspective, can you also see that strengthened rights actually have influenced the increased influence? I mean, can you see it in practice that the legal rights have increased the influence?
That's also a quick question, because I think that there's almost always, I think, a gap between policy and practice, not at least when it comes to policy which pinpoints more general rights without a clear connection to concrete efforts. So in this case, I think it's quite hard to know exact how CRPD in itself has affected decision making on national and local level. I think, for example, we have since a very long time, since 1994, we have a quite progressive disability legislation in Sweden, which contends it's not far from the convention actually. So I think some ideas has been internalized, I think, among service providers, but I think we know still too little about these dynamics between policy and the real practice. But of course there are things happening out there. We have a much broader repertoire of concrete strategies, for example. And of course, I think policymakers has been influenced, and practitioners as well, by the policy, of course. But it's quite hard to just pinpoint, CRPD specifically, I think.
And I'm sorry, I should say that it's the Convention on the Rights of Persons with Disabilities.
Yeah.
So this is like the international human rights convention that we have since 2006. Now, thank you, Urban. You will be getting back to us in a very brief time. But now I would like to introduce our next guest. And our next guest is Tone Alm Andreassen. And Tone is a professor at the Center for Study of Professions at Oslo Metropolitan University. Hi, Tone. Nice to have you here.
Hi.
And together with Espen Dahl, she is the head of Integrate. And Integrate is a core research group on coordinated assistance to enable integrated and coherent pathways to work for groups on the margins of the labor market. And Tone will be telling us more, of course, about this in a short while. And I just wanted to stress that also to Tone, you can actually post comments and you can ask questions, and you do this by using Slido. And you can, in the corner now, you should see the QR code that you can use if you're not already using Slido. So ask questions, slido.com 3980521. I would like to hand over to you, Tove. It's going to be really interesting to hear you.
Thank you. My talk will be about user involvement and not so much about integrated care. Today, terms such as co-creation, collaborative governance, participatory governance, or citizen experts illustrate the increasing popularity of citizens' involvement. Could you shift the PowerPoint? I think it's... next slide. I think it's fair to say that to some extent, this is a revival of an idea, an ideal that has been a hallmark of the Nordic model, a long tradition of cooperation between the state and organizations of the civil society. Civil society researchers have emphasized the Nordic countries' many state-friendly voluntary associations that are mediating between citizens and the state. Their cooperation with the public authorities has involved communication and contact, financial support, a possibility for influencing politics, but also a high degree of autonomy for the associations. The cooperation has taken place through some rather stable organizational models, such as more permanent advisory bodies or councils, ad hoc advisory committees, and formalized procedures of consultations and hearings. In Norway, it was this tradition and its models that disabled people's organizations drew on when they demanded influence on decisions that affected their lives and living conditions. It was also this tradition that the organizations later highlighted when they argued that user involvement should not mean individual consumerism, but rather the involvement of disabled people organizations. They understood disabled people to be proper representatives of service users, since they, as long-term users, were the most knowledgeable about the functioning of public services. And as a consequence, and also of the institutionalized ideas of appropriate ways of organizing involvement, Norwegian municipalities, regional health authorities, and hospitals, and the Norwegian Labour and Welfare Administration all have established user councils, both at national, regional, and frontline level. And organizational models from this tradition were also applied when a contact committee was established between the government and spokespersons for citizens who are socially and economically disadvantaged. The government even funded a voluntary organization, the Church City Mission, to provide organizational support to activist groups that lacked organizational experience and capacity. The City Mission was also given a facilitating role for a collaborative forum against poverty and social exclusion. In this forum, activist groups and associations could join forces and prepare for meetings with the government. Next slide. As the recommendation from OECD on the PowerPoint illustrates, the question of organizational design and facilitation of involvement process seems to be an ever-returning topic. The challenge is, I think, that the advocates of involvement are often more occupied with the whys than with the how of involvement. Too often involvement processes end in disappointment or failure due to a lack of clarity about the mandate, roles, and expectations to the participants, or a lack of linkages between the involvement processes and the ordinary operation of the political system and the public services. So processes that may be felt to be tokenistic cooptation might instead be badly organized, planned, and executed involvement processes. It is as if initiators and participants think that collaboration goes automatically and that the participants instinctively will know their roles and tasks. And nothing could be more wrong. Involvement means organization, and with organizational models come templates for division of labor and responsibilities, modes of decision making, positions, roles, and roles expectations. Therefore, the choice of organizational design affects the way involvement will work and potentially create output. Importantly, involvement also means work. There is a need for professional work to facilitate involvement processes and the application of their output, and the need for voluntary work of the involved citizens. You may change slide. Let me illustrate these points with two rather different involvement models. The model from the tradition of cooperation between the state and civil society, and the increasing popular model of employing people with personal user experience. Please be aware that my description now is of ideal types. In practice, there are variations in tasks, mandates, and implementation of the models. I said that organizational models come with basic templates, and the templates of these two models are embedded within different institutional logics. The user involvement model on the left is embedded within the logic of democracy. In contrast, the model of pair workers, the right column, is embedded within the logic of the labor market. Here, involvement means occupations and paid jobs under employment contracts. Within the sphere of civil society, the associations are, in principle, independent of the state and in position to select who to speak on their behalf. In the labor market, employers decide who to hire based on assessments of which applicants are best qualified for the position. The model of consultation and cooperation means input to service improvement via the regular decision-making system of public services. The peer worker model expands the service offering with a new type of help and support directly to patients and clients. You could reasonably expect of civil society organizations that they protest strongly against demeaning treatment or stigmatizing attitudes, and that they demand service reforms. In comparison, although the mere presence of peer workers may transform the services, reforming services is not a task given to the individual workers. The two models are not mutually exclusive. Rather, they can fruitfully complement each other. However, the tasks and roles of those involved, as well as the output of the models, are fundamentally different. My last slide elaborates this point. The orange column shows that the target group of pair work is individual patients or clients. In all other involvement models, the target groups are the professionals, managers, policymakers, or researchers. Of course, ultimately, these forms of involvement must benefit the individual patients or clients, but the pathways to improvement are indirect. The yellow column shows that involved users are expected to assume quite different roles. Pair workers are service providers like other professionals, although they provide support from a knowledge base of personal experiences. Spokespersons of user organizations are carriers of causes and concerns on behalf of the members and groups that the organizations speak for. They are expected to bring with them not only their personal experience, but experiences from the entire community of users. The red column shows that the models also place the professionals in quite different positions and roles. When services employ peer workers, doctors, nurses, or social workers become colleagues with people who might have been their patients or clients. When users are teachers in the education of professionals, the professionals are placed in the position of students. And in this position, they are not experts, but learners who are expected to learn from people who might otherwise need their expertise. In consultation arrangement and advisory bodies, managers and professionals are recipients of feedback or suggestions from spokespersons of user groups. And the professionals are also objects of the user's evaluation, and they will be affected by policy reforms when the outcome of user involvement requires of professionals that they adjust traditional practices and share their expert knowledge and decision-making power with users. And in addition, user involvement opens up new positions to the professionals. They can be facilitators of involvement processes and mediators who translate between the formal service system and the life world of the users. And they may act as change agents who work to transform the services. So, to conclude, the main message from this presentation is that we must not ignore questions about the organizing of user involvement. We must be aware what different models can bring forth and what they expect from both the users and the professionals involved. Thank you.
Thank you so much, Tone. One thing you're clear about, we have to focus also on the organizing. And I want to ask you about that because in Norway, if I have understood correctly, compared to the Nordic countries, there are often very clear structures for consultation at the system level. And what advantages and what challenges do you see with the Norwegian structure when dealing with the welfare state?
Well, I think that advantages and challenges go hand in hand because here as everywhere, there is no ideal organizational model. And I think one advantage is that structures exist, that user organizations have channels that know they have, and over time shared understanding of the tasks of these bodies and the role of the participants. They will be developed and institutionalized, and then the participants can focus on the matters at stake and leave behind the many discussions about the organizing of involvement processes that often take up so much time. And structures at the system level means opportunities to influence at the level of the top management. And that's, of course, important. But there is still a risk that cooperation takes place too far from the level where professionals meet clients or patients. And of course, access to decision-making power is an advantage, but structures at the system level also place high demands on user organizations to understand how the system works and to transform user experiences into proposals that might lead to the desired change.
I have another question for you because a general development is that many users today they act more on their own or in networks rather than rather than acting collectively in user organizations. So there is a trend that looks like that. And what does this mean? I mean, both for the welfare state and for user organizations. Do you have any thoughts on that?
Yeah. I think in a way that the most pronounced example of user acting on their own is peer workers. And the peer work model could, as I said, complement user organizations and cooperation at the system level by bringing experiential knowledge of the users into the front line of service delivery. And the peer worker model is itself a result of demands from user organization. And such is an example of a key characteristics of civil society organizations, that they have been a driving force for development of the welfare state. And I think also important is that in Norway, for example, peer workers in 2017 established an interest organization aiming to work not only for better working conditions for this new occupation, but also to emphasize that peer workers are part of an international movement towards empowerment of service users. So in that sense, peer workers and user organizations both belong to the same social movement.
Thank you so much, Tone. I would like to ask now Urban to come back with us for a little while. If you could join us back. There you are. And I also see Marie. Nice to see you both. I do have a question for Urban and Tone first. And nowadays, user influence, it's raised in a variety of contexts, and it looks very different from different target groups. Isn't there a risk that we generalize too much? What's your take on that? Who wants to start? Perhaps, okay, Urban, what's your take on that? Is there a risk that we generalize too much?
Well, to be honest, I don't think it's a major issue right now. Of course, you have to make some kind of division between concepts of more general relevance and experiences that are more specific for certain groups. But in my point of view, I think we are in a explorative phase right now. We are trying to develop new approaches. We are doing a lot of pilot testing and so on. So I think we have to wait a bit. I think with that kind of more specified analysis when it comes to specific groups and their needs. I think for me it's quite okay that we are just doing a great deal of service development right now.
Okay. Tone, do you agree? What do you think about that?
Oh, I think the question about generalizing was a little bit difficult. But if you mean generalizing across very different models of user involvement, I think it's a risk if you do not acknowledge that different models require and give different things. And if you ignore the fact that no model in itself produces desired results, they all depend on how well they are implemented.
I have a question for you because both of you are also researchers, and I'm a practitioner. So one thing I've been thinking a lot about, is there any area, because there is a lot of research that is being done right now, but is there any area that you see particularly important to do more research on? We need more knowledge. Is there an area that you think about spontaneously? You're both smiling, but give me your best tips. Yeah.
May I try?
Yeah.
I think we need more knowledge about the role of professionals and the position of professional expertise in the future, where service users have more influence on their own services and on the service provision at large. Much attention has been given to the users, and the understanding of what it means to be a professional has not yet incorporated implications of the user involvement movement, I think. And I also think that we need more knowledge about the interplay of different forms of involvement and different types of organizations in the field of user involvement, and about impact over time of this interplay. I'm very fond of in-depth case studies, but I think there is a risk that we end up with too many narrow studies of single involvement processes. And I think there is a need for a broader overviews and historical perspectives.
So that's a quite clear example. What do you think, Urban?
Well, there's a number of needs. I think, of course, I think that we need more intervention studies. Highlighting the new methods and new strategies, and with quite a lot of focus on outcomes. But then I also think that there's a need of to focusing on the implementation issue. How to translate these new models to the local practice level.
So I think now I would like to check with you, Marie. Has there been any comments or any questions coming into Urban and Tuna?
Yes, some questions. At first, the very practical questions. Will the presentations be handed out afterwards? And the answer is yes. All participants will get the presentations sometime next week. We also got a question about the term co-option. Could you please explain that a little more?
Yes. So could you please explain a little bit? Co-option?
I think we were both highlighting the co-option issue, didn't we? What did you say, Tone, about it?
I said that that processes that could be felt like cooptation, meaning that the involvement is just for symbolic purposes. It's not meant to really give the users influence, that's the danger. But I also think that often it's not about intentions to not give the user influence, but not taking seriously the organizing of user involvement, so that the involvement actually can influence services.
Yeah. And you, Urban, you talked about it as well. So what did you mean?
Yeah. In my as a perspective, it's quite much about service user groups being invited to let's say organizations driven by service providers, and that there's a risk that the service user perspective will be negatively affected by being a part of this community. So that's just, it could be a good thing, of course, but I think it's important to be aware of the risks of being too close to each other in some specific themes and situations.
Is there another question, Marie?
Yes, the next question has to do with the different models and how they are related to each other. Would you say that the different models of user involvement are mutually dependent on each other, like talking about peer workers and user organizations?
Are they mutually dependent on each other? What do you think?
Sorry, I'm not quite sure if they're mutually dependent on each other, but I'm quite sure that they complement each other, so that it is it's good to have several models at the same time.
And what do you think, Urban?
Yeah, I'll agree,
Yeah.
but it could be quite complex. But I think in most cases there is no problem to work on different arenas at the same time.
I think that now we're going to be having a small recess. Thank you. I want to say so much thank you to both of you, to Urban and Tona, for joining us this afternoon and sharing all your knowledge. Thank you so much. Now it's time to introduce our next speakers, and it's Anna Lindskog and Anna Nerelius from the National Board of Health and Welfare. And they are both program officers working for the division in the National Board of Health and Welfare that supports social services. And they are both focused on issues that includes homelessness and addiction. So first of all, warmly welcome to you, Anna. And Anna, very nice to meet you. And I also just want to remind that just as before, you can pose questions to Anna, to both Annas, and you can do that by Slido. You just use your phone, use the QR code, or use vvslido.com, and you will get to it. And I'll hand over to you now.
Well, thank you very much, and thank you for the opportunity to be a part of this seminar. I am Anna Lindskog, and then my colleague is Anna Nerelius. Before we start to talk about the preliminary study, I'd just like to say that this is not a research study. It's an internal document for the National Board of Health and Welfare in Sweden that forms the basis for our continued work. And the result from this study is considered in the annual planning for next year, and we do not yet have a management decision on whether to proceed with any of the proposals mentioned in this preliminary study. And as it is a preliminary study, we do not publish it. But if anyone would like to read it, it's not like a secret document or anything, so you can send me an email, and also Lars has a copy of it as well, so you can send an email to him as well, and he can help with the distribution. So, the preliminary study that we have done, it was 2 different aims of it. The first one was to describe obstacles or barriers that prevent increased user influence, and Urban was talking about a few of them. And the second aim was to find out what kind of support municipalities and the healthcare need from the National Board of Health and Welfare to develop the work with user influence. And this study was carried out this year from January, and it was finished in August. Next slide, please.
Yes, and the preliminary study would provide us answers to these questions. What needs there are for updates of already existing material and guidance on user influence at the National Board on Health and Welfare. And the existing guidance from 2013 is att ge ordet och lämna plats. Are there any needs of other support? And if so, what focus will it have? And in what form will it be? And the preliminary study also would provide answers to how information about user influence can be collected and spread to make it more available and known. And to carry out this preliminary study and answer these questions, we conducted a literature search about existing research and studies and reports and so on. We also did an inventory of the knowledge in the field, and we interviewed representatives from municipalities, from healthcare providers, patient and user organizations, researchers, and authority representatives. Next slide, please.
Okay, so we're going straight into the results and the results of what obstacles or barriers we discovered. The number one obstacle that the social services, the healthcare, and the user organizations mentioned was lack of good conditions to work with user influence in a structured way. And that means, for example, as Urban already said there, there's a lack of routines and structures that promote participation, and also time and resources to fully involve patients and users. Feedback of the result, if you have done work in this area, and understanding of how the results should be used to develop the support and care is also lacking, or a barrier to take the next step. Also, compensation models for the individual person that takes place in the work, as well as for patient and user organizations. And also difficult to know which methods or models that are effective when it comes to user influence or user participation. But one thing that we noticed was that it was more or less the same obstacles that was raised in 2022 as in the work with our guidance Att ge ordet och lämna plats, that's from 2013. Next slide.
Yes, and here you can see some examples of needs that emerge in the preliminary study. And as you can see, some of them are a reflection of the obstacles that we mentioned from the last slide that Anna showed. First, there are a need of support structure for working at the organization level and the system level, and clarifying the benefits of the work. There are also a need for follow-ups and evaluations in order to use the results for developing the work. Also, a need of sharing of good examples with each other. And there's a lack of models for pay for effort for the users or organization that contribute in the work, so that they don't risk losing other benefits, such as economic support from the social services. And there's a lack of manuals in user influence, and also a lack of knowledge of models or methods for user influence. And there's a need to find out more of how to work with different target groups, and a need for training and for further education. Yes.
Yes, and we think that the National Board of Health and Welfare could answer to a lot of the needs from the social services and the healthcare that we discovered in this study by doing the following three things. Update Att ge ordet och lämna plats, which is the existing guidance that we have. A lot of its content is still valid, but it needs an update. We could also do, we need also to have a new guide or a new manual with focus on follow-up and evaluation and how to develop the way of working with giving support based on the results of, for example, user surveys. And we also think that we could build like a new theme page on kunskapsguiden.se. And Kunskapsguiden is the site where the National Board of Health and Welfare publish information about specific issues, such as homelessness, mental health, elder care, and so on. And in an attempt to make it easier for social workers and healthcare staff to find new and accurate information. So a new theme that focuses on user involvement or user influence on that web page would be good, we think. Next page.
Yes, and finally, we have two reflections that is based on the results from the preliminary study. The first one is that many of the needs are already met through work and materials that are produced by other stakeholders. For example, there are manuals for user influence, routines for user influence, and compensation models and evaluation of methods. And the other reflection is that updates and work with new support manual needs to be done in close collaboration with the user organizations to ensure that work that are carried out by the organization is not taken over by the National Board of Health and Welfare. Yes. Thank you very much.
So thank you. I would like to ask you, because in your work you have identified, various obstacles that exist for user involvement. Which of them would you say are the biggest in municipalities and in different kind of organizations?
If I should answer that, One of the biggest obstacles that we have been identified, would I say, is if there is a lack of structure for the work with user influence, and if the work is not anchored by the management, and instead it is largely based on personal commitments. Then there is a big risk that the work will not be sustainable in the long run, and eventually the work will decrease or maybe die out. So I think that's the biggest.
So it has to be
obstacle.
anchored
Yeah.
well in the top, so to speak. You need to
Yeah, exactly.
I would like to ask you another question also. That the National Board of Health and Welfare, you came out with the guidance on user influence in 2013, and one of your suggestions in this preliminary study is that you need an update to this guide. What do you see? Is the most important, the greatest need to develop in the new updated guide?
Well, it depends, I was going to say. Well, we could see in the preliminary study that many of the municipalities find it difficult to work with follow-up and evaluation of the work. And when they do follow up and evaluate, they often find it difficult to know how the results should be used to improve the way they work. So if we don't get a go-ahead on doing like a whole new manual that focuses on follow-up and evaluation, then it would be the number one thing to put in an update of the existing manual. So that would be like the most important thing. Other things that we like to modify it with is also different good examples of new technology, how to use social media, and how to try to find people to work with if there are no local user organizations.
And that's also good. I mean, especially for us that are practitioners, when you have like good examples that are very practical, that helps out a lot. I would like to say thank you so much. You will be coming back soon, and I'm happy to see you in a little while again. And now I would like to introduce our next speaker, who is Jan Marius Gathen. Jan is an occupational therapist that has worked in different mental health services, and currently Jan works as PhD fellow at VID Specialized University in Oslo. And his research concerns user participation among people in vulnerable life situations, with a particular focus on interest organizations and the impact of user participation. So I'm very happy to have you with us today, Jan. Very welcome. And you can also, just like before, you can pose questions to Jan during the whole session. We will be getting back to all the questions that you're posing. Do that through slido.com using the code 3980521. I hand over to you, Jan.
Thank you. Thank you for the introduction, and thank you for the opportunity to be part of this webinar. It's been very interesting, the presentations. So I've been asked to talk about let's see, one of the articles from my PhD projects, which focus on interest groups. And just to make it a little confusing, I use the term interest groups and not service user organization, and also user participation instead of user involvement. But we have had some good introductions. But I just briefly mention that in Norway, official documents, they highlight interest groups or service user organization as vital for influencing the development of the welfare services and providing input to government policy. And they are also very important in promoting the voice of people in vulnerable life situations, because many can't express or promote their voice without support. So in this study, I've used insider-outsider perspective, which is it's a common theoretical perspective when dealing with interest groups. So what we have been talking about much today is the classical insider activities. It's the direct channels, often councils, committees, and so on, and direct meetings with professionals and decision makers, and also lobbying and informal meetings. And outsider activities are more indirect, and it's more connected to the social movements, where they had demonstrations and petitions and public meetings, and using the media and issuing press releases and that kind of things. So in this article, I ask, how do interest groups influence public actors, and what are the perceived impacts of this interaction? So what I've done qualitative interviews with representatives of 8 different organizations, and we wanted to have a broad perspective on this. So we have included very different service user groups: people with dementia, intellectual disabilities, substance use problems, asylum seekers, children in contact with the child welfare services, and children of parents with substance use problems. But all of these groups can be said to be in vulnerable life situations. So based on these interviews, we did a thematic analysis, and we developed 3 themes that reflects how the informants describe their interaction with the public actors. And these are like tendencies, and they are overlapping, but the informants also say that they maneuvers between them. But the first theme I've called the cooperative strategy, and here the informants talk about being insiders and participating in formal participation channels like council committees, and having meeting with politicians and professionals, and also informal meetings. And this is often described in concrete service development in the municipalities, or in political arenas in the municipalities. And what they highlight is that trust and dialogue between the stakeholders are important, and they often use words as partnership and collaboration. And they expressed that they seemingly had shared goals, the interest groups and the professionals or the politicians, and they have a mutual understanding, so they have a good relationship. And in these strategies, often easy to, or not easy, but they can see a direct impact of what they're doing, and that is kind of developing or changing existing services and improving the services, because they're working at a concrete level, and they also often receive increased funding for the services they provide, because many organizations provide services to their group, and sometimes often also the organizations or the public stakeholders take over some of the services. And it also results in increased network and more participation and so on. So in contrast to this, the second theme I've called the oppositional strategy, and here the informants talk about being outsiders, and mainly using outsider channels like the media and complaint systems like the legal system, and also developing their own services to meet the user group's needs, because the public services aren't doing that. So here it's more open conflict, and they try to exercise external pressure to create changes and create public attention around some issues. And this also revolves often around concrete issues in services or in policy. But a central goal is also to raise attention around the service user group and create sympathy and so on. And here the informants also talk about concrete changes in services and victories in court, but also more like general things like increased visibility and status of the organization and the user group, and expanded knowledge in the society. And the third theme is the negotiation strategy, and this is what they talk about the most. Here they operate mainly as insiders, and sometimes in combination with using some outsider channels. And this is what have been mentioned before, like the councils and committees. and so on, where they take part. And here they talk about the importance of maintaining a good relationship and being viewed as constructive and competent. But they also talk about being critical, but it's more of a moderate critique in comparison to the previous category, where they're more overt conflict and direct criticism. But they also talk about how it's important to promote the grassroots voices, and they use personal stories, and people with service user experience are also important to involve in these processes. And here the impact or effect of this kind of participation is often more difficult to see, because it's less it's often advisory boards and channels that they take part in. But it's easier to see changes at the service level than at the system and political levels. But they also describe the changes at these levels, but they're more unsure of that. But this is also new for the informants to talk about. They haven't thought so much about this. But of course, this can strengthen services and policy, and affect political agendas and that kind of things. So to sum up, the interest groups in this material shows that they use both insider and outsider strategies, but they seem to prefer the negotiation strategy and mainly use insider channels to gain influence. But it's interesting that they often talk about using an oppositional strategy or outsider channels if they have not succeeded affecting change in the formal or insider channels. So that's kind of interesting. And it's also been mentioned before, but the risk is that they can lose some of the critical voice in some of the by being insiders. Yeah, and of course we need to have more focus on the impact of user participation, because that was kind of new for many to talk about. I think that is about it.
So, perfect. Thank you so much, Jan. I would like to ask you one thing, because the issue of user participation, it has received, if I understand correctly, at least most attention when it comes to regard with people with mental disabilities compared to other vulnerable groups. What is this due to?
It's a difficult question, but I think Jens also showed that much of the research is concerning people with mental health problems, and it's probably can have to be due to the strong service user movement we started many decades ago, and that they have formed very strong organizations and became very visible in society. So I think that's a big reason for it. And maybe also that many of the other groups that I have talked about here, the perception of these groups have been that they can't really participate or talk for themselves. But I think that's changing, and I see that there are a lot of research emerging surrounding or concerning these groups also.
So, can I ask you just another question quickly? What do you see as the biggest challenges for user organizations to strengthen the influence of the groups that they represent? I mean, in the sense, what needs to be done to get greater influence? What would you advise?
Yeah, I think it has been mentioned, but I think if you ask the organizations, the funding of the organizations need to be strengthened, because it's kind of difficult to take part in many of these boards and panels and that kind of things without having more money, because many of the meetings are in daytime, and it takes time to prepare and that kind of things. So I think that is one of the issues, and it's also to mention that it putting a lot it's high demands for the organizations to participate. It can be kind of challenging to take part in many of these participation forums because we use a lot of professional language and so on. So you have to develop competence to participate. So I think we can make it much easier to take part in those kind of forums.
I'm going to introduce our next guest, which is Viveka Norman Andersen. She is the CEO of Social Development Center SOS, a non-profit organization which develops new approaches and solutions within the social policy area. And the stakeholders behind SOS are municipalities, unions, and NGOs. Viveka has a background as a researcher within political sciences and many years as a leader at university. And I would like to introduce you now. I'm very happy that you're here joining us. Nice to meet you.
Thank you.
Let's see. We're just going to test very quickly, Viveka, if it's working now. Okay, perfect. So it seems to be working, even though we are together here and there. So now I can hand over to you with a light heart. Thank you.
Thank you. Thank you very much, and thank you for having me on. And we should be able to see some slides in a bit. I don't know if they're on the screen. Yes, thank you very much. I've been asked to say something about how user involvement can be strengthened nationally and emphasize with an emphasis on the case of Denmark. And I promised the organizers that I would briefly touch upon the Danish case, since I'm the only one speaking from Denmark today. So just highlighting the three backbones of user involvement in Denmark, with primarily at the national level within the social area. First and foremost, legal rights to be consulted and involved at an individual level when in need of social services are granted legally. In that way, the rights to be involved and consulted with regards to which support and assistance the individual citizens is in need of is legally regulated, and there's an obligation to include the user. So, so the user has or the citizen has an opportunity to influence decision and the design of the support. So in that way, you could sum up and say that nationally, it has been a focus on strengthening the individual rights of the citizens and involvement in their own cases at the national area. Secondly, there's a National Council for Social Disadvantage that's appointed by the Ministry of Social Affairs, and they have as one of their main focus to encourage participation among citizens in vulnerable position. It works to provide conditions for this group of people to make their voices heard and to advance the system to accommodate inclusion of this particular group. And furthermore, it works to encourage municipalities to establish local councils for people in vulnerable and social disadvantaged position. So the third characteristic that I would mention is the local councils, and actually they're only present in a little less than half of the municipalities, and they typically consist of users, representatives from voluntary organizations, professionals, and in some cases politicians. But I will now give you an example of the way that we work in a Social Development Centre with user involvement, because we emphasize a manner in which we work not only with the individual case, but rather than looking at it collectively. So how can we give people with lived experience a position where they collectively can put forward their views and perspectives and be heard in that manner. We are also interested in trying to involve people that were mentioned in the previous panel debate, exactly those who are not represented in organizations. So how can we grant people in vulnerable position a greater voice in the development of social welfare and give them access to influence the knowledge-based frames and social policy initiatives that affect their lives and opportunities. And as a result, we have been applied methods for involving people with lived experience in these collective processes for two reasons: in order to obtain a better understanding of what we could call the wicked problems present within the social area, and to get users to contribute to develop more sustainable social solution in collaboration with other partners within the social area. Our experience is that there's a tacit knowledge of users that needs more focus when we try to solve pressing social issues. User participation in efforts to build a better system too often takes place on the premises of the system rather than the users. Someone else brings in the perspective of the users, and there seems often to be an unequal balance of power and maybe even a fragile relation between target groups and those who involve them. And furthermore, it's a challenge from both a right-based, a democratic, and a knowledge perspective. So in our experience is that we miss out important knowledge from people with lived experience. They are the ones that possess the knowledge of how it is to be met by the system. And who do we work with, or we would like to say, who do we work with? We try to create platforms where people with developmental disabilities can be included, mentally vulnerable and users of psychiatric services, young homeless people, young people in foster care, unemployed in vulnerable positions, vulnerable families with young children, and next of kin, just to mention some of the recent processes we have been engaged in. Some of the methods that we use for involvement are making individual lived experience into collective knowledge, granting people with lived experience the access to be co-creators and sparring partners when we try to create new solutions or understand the problems, making them co-investigators and analytical partners, and finally involving them as co-evaluators and advisors in our work. The figure here shows the key element of how we try to involve people with lived experience. First and foremost, by inviting them into the framing of challenge. Too often we see that we define through our interview guides, through surveys, the way we frame questions, that we frame the challenges just by the way we ask questions. So try to really create an open space where we grant people with lived experience there a position so they can define what's at stake. Provide a space to meet and opportunities to share stories and develop collective insights based on that. And in that way, we actually grant a privileged position to those people with lived experience, because we think that the rest of us, the knowledge we possess, either it's research or it's professional practice, we have a privilege. Our knowledge is granted an access, but the people with lived experience needs a privileged position before we can bring in different types of knowledge in a way that positions the knowledge of people with lived experience as equally important as research and experience from professionals. We take care to include also the people with lived experience in the analytical spheres. They're not better analysts than the rest of us, but together we bring forward different perspectives and also keep them in the room with dialogue and negotiation of what is important takes place, and in that way to facilitate co-creation of new shared knowledge, and make sure it's a collective decision which prioritizing is taking forward, for instance, to politicians, to other decision makers, to the way that we want to make public the issues within a particular group where they feel that something is at stake. and try to bring them in also to imagine the future together and focus on necessary steps ahead so we can together try to create more solutions. Yes, that's right. Okay. If I just should briefly end or
I'm
okay,
so
you are
sorry,
here, Hanna.
Vivica, but we
That's
have
okay.
a very tight schedule, so the time is
Yes, that's okay.
But I would just we will be coming back a little bit later. But I would like to just ask you. You work with several target groups. You've been describing it, and has any project or work been particularly successful to inspire others? Do you have something you want to lift specially?
I think the work with young people in risk of homelessness, or young people who are brought up at foster care homes, have been particularly inspiring to see that every time we work with them, new perspectives come up that we hadn't imagined beforehand. And furthermore, we see them, even though they're not in the beginning not represented by any organization, they have not been used to be included or being listened to, or anyone was interesting in their perspective. Seeing them going out and actually joining other organizations, speaking up on behalf of their groups is just that's really a great joy to be able to, a privilege to be able to work
You'll be coming back
in
in a
that
little
way.
while for the panel discussion, and then we can also have, if you have some important words that you didn't have time to stress now, we will be coming back to you in a short while. So thank you so much for joining us. Our next guest is Tormund Kluvnin. Tormund is a trained theologian. Oh, hi, I see you. Hi, Tormund.
Wow.
Tormund is a trained theologian. It's difficult for me in English to say this. You will say it better probably than me. And has broad experience from the armed forces, the Church of Norway, and the cultural sector. And Tormund is a mentor in the Norwegian Correctional Service and has positions in the Board on Family Protection as well. And on a daily basis, Tormund is also an advisor at the Norwegian National Centre for Knowledge. So, through experience in mental health. So I'm handing over to you, and thank you for joining us.
Thank you for having me. Please start the presentation. So, as you can see now, the first slide, please. Here we go, the first one. This is the first. You have to go back 2 slides. And one more thing. Oh, sorry. Oh, this is not. Here we go. We are a small national competence center based in Skien in Telemark, Norway. We are currently 7 employees, and the center grew out of Norway's largest user organization in mental health called Mental Helse almost 15 years ago. Now it is a more independent center with its own board and its own item on the state budget. So our mission is to collect, systemize, and disseminate the experience-based knowledge of users and next of kin. And we work to ensure that the experience of users and next of kin are used in the services in the mental health and substance abuse field. So generally, we would work for a more user-friendly, more ethical, more democratic service. And since we are few people with a large mandate, we have to limit ourselves and work project and team-based. Examples of topics we have worked on would be like alternatives to coercion, patient rights on various kinds, such as individual plan, confidentiality, discrimination and human rights, record access, recovery, peer supports, next of kin, children as next of kin. So user participation or user influence is something we are concerned with all the time, of course, actualized in the last couple of years where we have organized a conference about this, the Summit 2022, published 3 books and an anthology. So feel free to visit the website or follow us through the newsletters. So click. Please change the slide. Can you change the slides, please?
There's the studio is trying to change the slides. They're having some technical difficulties. I'm very sorry about that. I'm trying to communicate between here since I'm not a technical expert. They're working on. Is it working? Okay, I think. Sorry about that.
Yeah, you can just click so you see all the booklets. Thank you. So when you want to cooperate and participate in the recovery process, it's necessary, of course, to have knowledge about the system and of knowledge about your rights and your duties. And also digital health expertise is important. So at our center, we want to arrange information about rights in a way that ensures good accessibility and understanding for users and patients. My colleague Arnil Løveng has now completed a series of 9 booklets with different themes, and you can find them easily on the website or just scanning the QR code here. We have distributed more than 20,000 of these booklets, mostly for free at conferences, but also through our web shop. So click. So we arranged a summit this year with an around-the-table discussion, and these are the main recommendations we found. Better framework conditions within mental health are necessary to achieve real user and next of kin participation. When people with a need for mental health service are routinely rejected without an offer, they have practically no opportunity to participate. Also, for those who receive an offer, it's most vital that there is enough time to build relationship and real possibilities for individual adaptation of treatment and follow-up. Secondly, good procedures and access on different methods. User participation should, of course, not be dependent on the individual health worker's commitment or interests. It's a leadership task to ensure that good routines for user participation will be implemented in the services, and that the employees have access to good methods for user participation in practice. On a superior level, user and next of kin participation should trigger rates so that it is profitable and possible to prioritize, just as in other practice in healthcare. We should emphasize and test out different methods to strengthen user participation. And then we talk about competence development and attitude work among employees. Employees need more competence about user participation. This would include both knowledge of laws, rights and duties, practical skills on user participation, like how to formulate questions, thinking process, good communication, etc. And last but not least, more information for users, patients and next of kin is really needed, so that they can demand their rights and participate in a good way. They need readily available information, both on rights and duties, and about illnesses, prognosis, and treatment options. This information should be provided in different ways, both through the websites and written information, various courses, group offers, and in direct dialogue with the therapists. This is, of course, just a brief summary of the summit. For deeper understanding, read the whole story on the website. Please click. And finally, some weeks ago, we could hand over the recommendation from the summit to the Minister of Health in Norway, Ingvild Kjerkol. So we hope that the summit participants' input will be useful in further work for national recommendation on user participation, which is now in progress here in Norway, for a common goal of good methods, good and relevant healthcare services. Please click. So please click the next slide. Oh, we have trouble again.
Yes, there was trouble again. I'm sorry about that. They couldn't click it. Would you want to tell us what was on the last slide, or should we?
The last slide is about the book we just released, Critical Perspectives on User Participation.
Oh.
So it was kind of mandatory to talk about, but I guess maybe
that's
you have
good actually, Tommy, because my question is about that book. Because I know you just published it. So I wanted to ask you about that book. In this book, if I understood correctly, you show that critical perspectives on user influence are needed So what is it that you particularly want to problematize with user influence? What needs to be done? So could you just give us
Yes,
I
it
know it's
sounds
a
a bit.
big question because you wrote a book, but like if in a
It
minute
sounds
or
a bit
two.
negative when they talk about problem. It's not a problem. Criticism is a good word,
Good.
as my fellow Norwegian Jan Marius talked about. And the editor of this book, my colleague Eskil, he made a fresh start when he says that he quotes Michel Foucault, who said once that to practice criticism is to make harder those acts which are now maybe too easy. So it's about not taking anything for granted just because the majority and the politicians roll out the red carpet and talk about user participation in big words. And the author describes the book's project like this. In the book, we seek to ask good questions so that we can think better about user participation. Because user involvement in mental health and substance abuse is a field with very high ideals, and ideals are often good guidelines, but ideals must not be confused with reality. So goodwill is important, but not sufficient to obtain health services with optimal user participation. So in addition, the means must be consistent with the purpose. If user participation is to be better for those whom it should be, we need more knowledge, of course. Everybody says it today. We need more knowledge, and this book is about asking the researchers, what do we really know, and why? How do we know it, and how can we measure these important questions in a good way? So here we go. This is the book, and this is the editor, my colleague. So if you want to know more about it, so just kind of go to buy the book, read it. It's hard to sum up a whole book in just a brief answer. Of course it is.
So that was an important actually to show because you had the QR code. That was really and just like I say, it's not it's not a problem. It's different critical perspectives. So I'm gonna ask you to not leave yet, Tormund. Just stay ahead because you'll be coming back in a little while in the panel. And thank you so much for being with us here today and presenting. Now it's time to introduce our last guests for the day. We have Anna-Lara Steindal, who is a project manager for diversity and sustainability and has an educational background in philosophy with a special focus on ethics, diversity, and identity. And Anna has worked as a project manager for refugee resettlement and human rights and is currently the project manager at the National Association of Intellectual Disabilities. And we also have Sunna Agustdottir, I hope I pronounced that correctly, is a project manager for consultation and equal participation. And Sunna is autistic and brings a valuable perspective into the work. She has worked on many different projects connected with consultation and user involvement at both the national and the European level. And you both work for an organization that I actually need to pronounce the correct way. So I'm going to hand over to you and ask you to pronounce it the correct way because I don't want to make a bad mistake. So I'm sorry about that. And I'm handing over. Thank you so much. Handing over to Anna-Lara.
Thank you. Yeah, Sunna and I work for Þroskahjálp, which usually translates into the National Association of Intellectual Disabilities. Can I have that? Yes. I think we can say that maybe we at our organization approach the issue that we have been discussing today in a little bit different manner than has been talked about here. And there is a reason for this, because in recent years, we have been putting more and more emphasis on what we can call user involvement, or like bringing the people we work with and for to the table. And also because the group of people that we work with are becoming is becoming more diverse. Meaning that, yes, we work for people with intellectual disabilities, but people with intellectual disabilities come in many shapes and forms. So we have had more and more people with refugee background, with immigrant background, and people belonging to other, if we can call it, minority groups. And it was, sometimes it was a challenge. So we have been trying to step up our game and do better when it comes to consultation or user involvement, or simply bringing the people into our work. So we have adopted this framework based on diversity, equity, inclusion, and belonging. Can I have the next slide, please? So DE&B, as it is sometimes called, is, I think we can say, growing trend in management, especially when it comes to diversity management. And we think this is a good tool to use because it's offer a kind of framework to have a discussion about how we can include everybody, like not only within our organization, but like in the community as whole, because we are trying to influence the society that we live in, and we're trying to change it. And if we are going to do that, we need like a common language, if you like, or a common framework to, discuss how we can do that. So DE&B is based on a principle of diversity involving people with a range of social identities, on equity, creating systems that ensure equal access, inclusion, ensuring that all voices are heard. And I think this is very, very important, but sometimes forgotten, promoting a sense of belonging or empowerment, because it is important that we all work together. And in this vein, we have done many projects in collaboration with, mostly with the Ministry of Social Affairs, including composing a manual similar to what was introduced earlier about consultation and user involvement when it comes to people with intellectual disabilities. Next slide, please. But back to the framework that DE&B offers. I think it's, I sometimes compare it to the framework that the SDGs offer, because like most sectors have pledged to work in the spirit of the SDGs, and this applies also to some kind of diversity management. So we believe that this approach is can be applied not only within our organization, but also when we are trying to work with the media, to have better representation of diverse group of people, with the workforce, with companies, with schools, with like every sector of the society can be, this approach can be applied everywhere. It is easily translatable and applicable to many, many areas. Thank you. And next slide. Now, and what have we learned? I think one really, really, really important thing is that it is not enough to expect that you can have like a DE&B officer who is responsible for diversity management or someone in human resources, because there needs to be a sincerely deep commitment within the whole structure of those who are involved in like working with within this framework. Meaning it can't be only the responsibility of individual counselors or individual staff members. It needs to be like interwoven in the whole fabric of the structure using this tool. And probably it means that we need to abandon doing business as usual. And next slide. There has been some discussion about the importance of training people to participate in user involvement, but we actually look at it from the other way around. We think it is more important to develop more inclusive ways of communicating in general. So, like, it would be easier for different groups of people to participate in the conversation. So instead of using like complex language, we can always use simpler words. And we believe that more inclusive communication is going to benefit a wide audience of people. And this is sort of like reasonable accommodation in practice. And as we all know, reasonable accommodation is like the heart or center almost of the UN Convention on the Rights of Persons with Disability. we have also discussed how important it is to offer accessible and timely information tailored to the needs of all recipients. Equal respect is of utter importance, meaning that it is important that only if absolutely necessary do we take special measure for some. And I'm not proud to say this, but sometimes we would have people with intellectual disabilities participating in our meetings, and then someone was sent into the meeting to sort of translate to them instead of just speaking in a more inclusive language. So, and we need to create a sense of trust and teamwork. And we were talking about criticism and how important it is also for us to can be openly receive criticism. Please, next slide. And I think it is important to understand that we're not, even if we have created manuals, it is never a job done, because in our view, the development of these practices is a gradual learning process. It always depends on the setting and the team. And what is applicable to one person might be completely out of place for the next. But the process needs to be in constant, under constant reflection and supervision. And we need to be really, really open to the feedback of those who are working with us. And, perform regular assessments and adjustments. And accepting that mistakes will inevitably be made, and have enough humility to correct them. We are quite passionate about this, and we try our best, but still we have a long way to go, and we make many mistakes. As was mentioned in the beginning, I'm here with my colleague, Sunna Dögg, who is autistic, and she's on the, can I say, the other end of this experiment that we are doing here with diversity, equity, inclusion, and belonging. So I'm going to move now, because Sunna is going to take the panel. I have explained what we are trying to do, but now Sunna can actually comment on how we actually, how we are performing and how we do. So thank you.
Hi, Sunna.
Hello.
I would like to start by asking you, what needs to be more done? What needs to be done more to support users in Iceland and organizations? What do you think?
My main opinion about this revolves around simpler language. Icelanders are very proud of their linguistic heritage. So most Icelanders try to speak a very complex version of Icelandic, which is not accessible for everyone.
And how can you do that? How can you speak a more easy language? Do you have any best practice on that? Do you have any good examples?
Maybe we could use simpler words like, I don't know, it's very hard to apply to English, because Icelandic is of course a very different language from English. But I could tell you that it's very important that we ask people. If someone doesn't understand something, you just ask, do you understand? And if they don't understand, you need to respect that. It's not them being stupid, it's you being too complicated.
Thank you for telling me that, because I didn't know how to pronounce the name of the organization. So that's why I asked before for Anna Lara to tell me. So it was very good. It was actually a good example also. We are going to now invite back some of the other people who was here before. So we're going to invite back Vibeke, Tormund, and to have a conversation with us. Oh, very welcome back. I would like to ask you all one thing. It's been a couple of hours now. We've heard a lot of different angles, different perspectives. So based on what you've heard today on user involvement, is there something you would like to highlight as something that is very important from your experience? Or is there something that you disagree with, which is interesting, because we said before that critical perspectives is not something bad necessarily. So is there something you would want to highlight this I really agree with and something I don't agree with? Yeah, Suna, what do you think?
Sorry for taking off more time, but I want to really just say that we need to be more open. And when we think too systematically about people, they stop being people and start becoming statistics. That is when we start to violate human rights. We need to just stop thinking in a systematic way. We need to be open for learning and experience.
That was a very good and critical perspective on that. Yes, please, Vibeke.
Yes, and just thinking back to what you said, Suna, about also adjusting the language. That when I heard about the measures, I thought about how we could exactly utilize and value different kinds of knowledge and making it the task of research rather than the task of those people with lived experience to develop new methods, so that it's not the rest us working with it in practice that has to adjust to research and fit into particular systematics and methods, but the other way around. I would like to see a change in that direction.
Do you have any thoughts, Herman, on that? What's something? Yeah, please.
Yeah, I totally agree on the awareness of language, of course, but then again, we have to remind ourselves constantly that science and research is a kind of complex thing. So everybody who work in a complex field need a complex language, and so it's kind of natural that things become complicated in one way, but then we have this, you need to translate it all the time so we can understand it, but it's not every time you translate, you miss something, and researchers are really afraid of missing the details and everything they find out. So it's not that hard to understand why it becomes sometimes a complicated language.
And it also sometimes becomes complicated because of the language, because we come from different Nordic countries. And I remember just when we were planning this webinar and I was asked to lead it, and I asked them, which language should we lead it? And I was told it was going to be in English. And I was like, okay, but that is not the native language of any of us. So, and that's why some of the words, I don't even know them. So I'm trying to find out, and I apologize if I say the wrong words. Suna, please.
Sorry. I have to respond to when we speak more complex language. We shouldn't look at it as a good thing. It's not good. It can help us explain things, but isn't it just way easier for all of us to explain things as they are instead of trying to use a word that someone doesn't understand? Because it's not right that just some of us don't understand everything. Just some of us we should all understand what is being said. And I think I would rather we miss some points on what is trying to be said instead of someone feeling very excluded.
One thing that I think about automatically is because we recently had elections in Sweden, and before the elections, there was a lot of user organizations that were actually going out and saying what you're saying, Sonat. So they were actually demanding for the political information from the different parties to be more excessive, like using klarspråk, using lättläst, which is Swedish words, but like easier language, so that you could actually understand what politics were saying. And so I would like to ask you one thing then to all of you. So when we think about that on politics, what kind of political initiatives would you like to see in your respective countries to strengthen user involvement? I mean, what should politics do? Because we talk a lot about research now, but do you have any ideas on that? Yeah, please. Vibeke, would you like to start? Yeah.
Yes, I think that it should be the ambition of our politicians and also the ones working within the systems. And it's no matter whether it's the public sector, it's also the volunteer sector, that we should really strive to reform the way that we think about helping those that are termed social vulnerable or social disabled in a manner where we accommodate their perspectives, and we actually strive to make systems that are meaningful for them and based on their premises rather than the other way around.
And Suna, did you add something there?
Yeah.
Yeah.
It was more for me. I really want politicians to be held more accountable and know how to be humble, because at least here in Iceland, our politicians are not humble, and the more that I meet politicians, the less of a good opinion I have of them. They talk the talk, but they can't walk the walk.
But would you wish for something special, like from the Icelandic perspective? Is there something you would need? Like if you could, let's say tomorrow you get into parliament, you're elected into parliament, and you can decide for a change that would be needed politically. What would that be? Do you have an idea? What would you like to change?
I would like to change how politicians treat, like speaking with disabled people and involving disabled people. Because as a disabled person myself, I can say it's often very tokenistic. They are like tokenism. They are involving us without really thinking about our comfort, thinking about our involvement. They just want someone that can speak for them and look good doing it. They don't and also with the parliament, I would really, really want them to change, make some rules or something about how parliament reaches out to people, like how we use our language again. Just maybe some rules about how that our language needs to be accessible if we are in parliament, so that maybe intellectually disabled people or just people who are from a different background can join in and take part in the discussion.
Yeah, but that's really interesting in the sense also that you do have a lot of legislation. For example, in my country, there is a legislation on different national minority languages that authorities have to use, and you also have sign language. So that's also interesting. When we talk about easy language, accessible language, could that actually be legislated about having a demand on authorities? It's a very interesting, concrete political initiative. But Tormund, could you tell us what kind of political initiatives would you like to see?
It's like in the song, it's a long way to Tipperary, so we are on the way. And sometimes I want to say that we are not, it's not that bad all around. Really, really good things are happening, and a lot of research are being done, and a lot of conferences and take a hold on this issue. But it's like user participation is kind of fresh produce. You need to maintain it. So we have to secure what we already achieved, and then we have to look forward. What will be the next thing? And I remember a song by the Canadian singer Leonard Cohen, and the name was "Everybody Knows." And sometimes I think this is not rocket science. Everybody knows that user participation it's expensive. It takes time. It's expensive to educate the practitioners. Everything is expensive, and everybody knows that the users need more time in healthcare, and it's expensive. So everybody knows what we do with the gap. It's like when you go to London and you take the subway, and they always say on the speaker, "Mind the gap." And there is a gap between what we know and what we do. And that's interesting to focus on. Why is it so hard to do what we know? Maybe it's because of the money. I don't know.
So I would like to ask you, Marie, because I know there's been coming some questions also from the participants. So could you please, I hand over to you. Are there any questions?
Yes, we have a question in the chat regarding perhaps the gap, could we say, between research and results, that we put a lot of effort into research and description of how we create user involvement, but how about the evaluation of the results? Are there, for example, studies or experiences of how systematic cooperations with users affect priorities or how services work? I think a good place to look for answers is the soon-to-be published report by Jens Ineland, but maybe some of the panelists here has some opinions about this.
So do you have some opinions about that? The effect, the result? Any studies on that? Viveke, Tormund?
Yes.
Yeah, Viveke, please, go ahead.
Yeah, okay. I think it's very limited evaluating the impact of user involvement. And I think when I was thinking of, about this panel, the debate, Hanna, based on your clues on it, and listening for today, I get sort of the let's just go and do and experience more within all involvement. Let's be inspired across the Nordic region on the good examples, how to conduct, go about it, and dare to experience more with different forms of involvement, rather than beforehand thinking that we need more knowledge, and then let's hope that somebody wants to look upon it. And I think that just maybe it's dangerous to say the fact, but we are really within the social area striving with problems that's been ongoing for a decade or two that we haven't solved. At least in Denmark, we see statistics on young people in not in employment or education or training after basic education, that it hardly has changed for 10 years. So we haven't solved what's the really problem, and going out and involving this group of young people in what they could see as helping enlighten us others what's the problems at stakes, and involving them in trying to develop new solution. At least since we are stuck with the methods that we have been trying for decades, then let's try something new and then see if something better comes out of that. That would be my perspective, rather than wait for more knowledge.
Mm-hmm. Yeah. Do you want to add something to it? Yeah.
Yes, of course. I agree on some of it, because science is a slow train coming, takes a long time, expensive to find those key points. But then again, politicians and healthcare wants to work science-based, so we need the science. So that's a part of the issue. But now we're talking about evaluation, feedback, and that's a more quick one. So we can work out better feedback tools, so we get good feedback from the users and next of kins to adjust after. Of course, feedback tools is an important thing.
It's 1 minute left for before 4 o'clock. So I think actually I'm going to thank you all very much. Thank you so much to Viveke. Thank you so much, Suna. Thank you so much, Tormund. And thank you so much for joining us today and for this seminar. And I also want to say thanks to Anna-Lara Steindal, that is not in the picture right now, but that was presenting just before. So thank you so much. This has been, I hope, a very interesting webinar. It has been a pleasure to listening to all guests. I've learned a lot. Usually I'm a practitioner, so I'm more used to talking about practical examples than research. So this is also, it's been very valuable for me. For all of you who've been joining us on this webinar, thank you so much for doing this. You can find this for 2 more weeks, and you will also, next week, you will be able to get all the presentations. They will be sent out to you. I know that on behalf of the Nordic Welfare Centre, I want to say thank you, and I would like to end up with a quote. If you want your content to be great, ask your community to participate. So that's a simple but clear message. Thank you so much.